Mikey's in timeout. Just kidding.
So what muscle would we find in, actually I want to do this. What muscle would we find in the lips?
Isn't that one of the circular ones? That
I
one?
heard something.
She said circular.
We start with
Orbicularis
Yes.
oris. So that is the first sphincter of our digestive tract. We have 4 sphincters in the digestive tract. So the beginning one is orbicularis oris. The last one is the anal sphincter. And between the stomach and the small intestine we have one, and between the small intestine and the large intestine we have one. So this would be the orbicularis oris for both of those.
The esophagus doesn't count now?
It's not a sphincter. All the muscles do constriction, but there's not an isolated, between the esophagus, oh, there are 5, thank you, yes. The esophagus and the stomach is one, yes, and then the stomach and the small intestine. So we would have our mucous membrane extending over the bone as our gum. What's another word for the gum tissue?
Gingiva.
The gingiva.
Damn, girl.
The space between the lip and the gum, or between the cheeks and the gum, is the same name as we call the nostril space. So the vestibule. So it's not just in the front, it's all the way around. That would be the vestibule.
between lip and gum.
So if you take your tongue and you think you've got something in your teeth, you would kind of scrape it around over your teeth. It's in the vestibule space.
Why did you outline that in blue?
It's the mucous membrane, or the skin. And then, so this would be the hard palate. And then when we don't have the bone tissue, it would be the soft palate.
Gosh, how many key turns?
Fancy word for lip is labia. So this would be the superior labia and inferior labia. So what nerve is going to innervate the lip muscles and the buccinator muscles to keep food? Facial nerve, good.
Oh, I got it right.
So facial nerve is going to do cheek and lip muscles. And now we have some other muscles coming off of the genu and forming a large fan-shaped muscle going up into the tongue is our, well, you tell me, what's the name of that muscle?
Which one?
No,
From which one?
from here to tongue. No,
Something glossal.
genioglossus. All right, so this one right here
You're on fire, girl.
is the genioglossus. Coming from the tongue, or going to the tongue, forming a lateral support off of the hyoid bone, hyoglossus. And coming down from the styloid process, whoops, wrong direction, this is the way I drew it this morning, and attaching into the tongue, holding it up and back when you swallow. Styloglossus. look at the tongue of our small larynx, all right, so this muscle right here
Styloglossus.
would be the styloglossus. This muscle right here, coming off the hyoid bone, hyoglossus. And then the meat, if you will, of the tongue is the large fan-shaped genioglossus. There is another muscle that ends in the word glossus. I mentioned it in my 430 class, but didn't really require students to know it. Coming down from the soft palate into the tongue, the narrow muscle, paladoglossus, yes, paladoglossus, and then coming from the soft palate to into the pharynx, we have another muscle which is the palatopharyngeal muscle. And this creates the space in which we find the palatine tonsil.
Uh-oh, what was that?
So let me put the palatine tonsil in there. What'll be a good color for her?
Purple.
Is it attached to epiglottis?
Pardon?
Epiglottis is on?
Epiglottis is right here.
Is it attached?
Oh, is it attached to it? No.
Is it attached to it?
It goes into the wall of the pharynx, into the constrictor muscles. So we'll put our palatine tonsil in here. So, or just paladoglossus, palatopharyngeus. You don't have to have an AL. You can just use it as an ES, palatopharyngeal, palatoglossal, paladoglossus.
Oh, wait, there's two.
All right, so now let's kind of stop there with all these words and come back over to the nerves. So what nerves are going to innervate muscles of the tongue? Which one?
Hypoglossus.
Not epo. Hypo, okay. Anybody remember what cranial nerve number that is?
12.
12.
Dang, Stacy. Oh, fuck. Psh,
So hypoglossal nerve.
she got it.
Accessory is tongue as well, doesn't it?
Accessory does, no, glosopharyngeal does. Accessory does sternocleidomastoid and trapezius.
What is it? I don't know, I read in a book that like the last 4 deal with swallowing.
Accessory's really,
Oh.
yeah,
'Cause it was like, it's also swallowing.
there's a very, if it does, it's only a very minor component. All right, so now we have, let's see if there's any other structures in here that I want to identify. Sensory to the tongue, I'm going to put that on a different image. So I'm ready to erase this
No,
picture.
hold on.
She said it, but she didn't write it down.
I didn't say I would, I said I was ready.
I didn't draw it.
So the palatopharyngeal, that is, you said what?
I'll draw that again. The next picture on the diagram is one, you have it in your lecture notes. It's with the, just looking through the front of the mouth and the posterior wall, seeing the arches over the back of the tongue.
No.
Yeah, reflect.
I'm good at that.
This is why I'm doing it again.
Good at what?
Teasing, being a
Know these
tease.
muscles.
Teasing you?
I'm
I
teasing.
feel like I
because
heard it, I know it, but I can't remember it.
Yes.
So facial expressions muscles
Yeah, so buccinator, it's muscles of
Not
facial
all of it,
expression.
like those palatal
The muscles of the
muscles.
lips
I
and
know those.
buccinator we would use for processing moving fluid around.
Oh, is that from last semester?
I mean,
Didn't we learn that someone this semester?
Okay,
Last semester.
now may I?
No.
It took you a long time.
You missed a whole big drawing.
Next time you have to bring in 20.
No, they dropped my first one, so I was sitting there pissed. I wanted to just give my money back so I can leave already, please.
What's that little thing?
That's fine, I'll get a picture.
Did you take a picture of it?
Yeah. Well, you have it on your video.
All right, so now let's look at a different orientation to the mouth.
What's this?
And we're gonna look at this view. I'm not gonna diagram this view, I'm gonna diagram.
Orbicularis
Oh, we can look
orbis
at this.
muscle.
Okay, so these structures are on that first page of the mouth. I couldn't do it really very well on a sagittal view, but we have 3 frenula. And somebody in the morning class said, so what does frenula mean? And I didn't know, I had to look it up. It means bridle. Bridle.
Like getting married?
So when I looked it up, all the references, I just looked up frenula. All the references were to the little bit of membrane that attaches the foreskin to the glans penis. So you can think of that every time you think of the labial frenula. But we have a frenulum between the lip and the gum on upper and lower. And then you have a frenulum between the tongue and the floor of the mouth. Okay? So those are, you're not going to see them in our models. I would have to use a diagram for a quiz or an exam. Individuals that have an extensive, enlarged or longer frenulum up here have a gap between their 2 teeth.
Oh.
Individuals that have a prolonged frenulum under the tongue are tongue-tied. They have a difficulty pronouncing the words. They can't move the tongue as well as they should. Right, so I just tucked my tongue down behind my lower teeth and tried to use my lips, which can be very difficult when you're trying to say certain words.
Can't they cut that?
Yes.
No, it's not that difficult. And mine's not cut over here.
Huh?
Mine's attached over here too. It's not that difficult.
But it depends on how far it's attached.
That can come.
But it can be cut.
Are there surgeries to have that fixed?
Yes.
Yeah.
They can get air surgeries and they have that fixed. Okay. Now ventriloquists can talk with just a loop using their tongue and not using their lips. But it's really difficult to say letters like V or little like V. My dad's a ventriloquist. So we made our own little dummy when we were in high school. Yeah, he got throw his voice, but yeah, he's pretty good. We used to play tricks with his little doll dummy. I mean, his name is Elmer. And his clothes are from the late 40s. He's worn the same outfit forever. So when when I was like 11 and 12, he helped us make one. We carved out the head. This guy's a redhead, so we made, his name was Curly. So we learned the mechanism of how they put a leather piece under the here so that the mouth goes up and down and stuff. But I remember we were away at camp, and he'd come up for the weekend. This was in the Philippines, and they asked him to do a ventriloquist show. And we didn't have Elmer, so we just took one of the kids and set him on his lap and said, every time I push your back, I want you to just open and close your mouth. Oh, it worked out well. All right, so I'm going to draw this portion to it and the tongue lower so we can look at the surface of the tongue. And you have this image in your lecture notes. Okay.
So the gap between your teeth has nothing to do with sucking your thumb then?
That can make your teeth protrude outward, but not create a gap.
Oh.
I suppose if you already have a gap and your teeth are protruding outward, that's what spread it apart.
My daughter has a gap between her front teeth. And I keep telling her, stop sucking your thumb. That's what I thought it was from. She's my only thumb sucker, and she's the only one that has a gap in her teeth.
Well, how old is she? Because are they her secondary?
Her baby teeth.
That's normal.
Oh, really? You should see it. And then she chipped one of her teeth, so.
Okay, so here are these folds that we talked about, and remember our tonsils, our palatine tonsils, are found between these 2 folds. The folds are created by the 2 muscles I diagrammed earlier. So when we see the examples of these, we're really not seeing the folds, not seeing the muscle. We're seeing the mucous membrane draped over it. When we put two folds together, it creates an arch. So I don't really care if you identify it as the lateral glossal arch or fold or muscle. If it's muscle, it's going to be typically, glossus. And then the more posterior one would be the platopharyngeus or pharyngeal fold, or if we use both of them together, you see an arch.
SUS both plateau glossal?
Pardon?
What is it? SUS?
Palatoglossal.
In parentheses.
In
Glossous.
parentheses, there's an S. If it's a muscle, it would be platoglossus muscle, platopharyngeus muscle. So if you're just naming the muscle. But again, I'm not picky about that for this because it's just really in reference to the same location. All right, so back here, we would have our other tonsils associated with the oral region, which would be our lingual tonsils. And we don't have it tilted quite as far forward as this time, so I'm not showing quite as much of it.
Oh.
Okay, and then looking at the surface of the skin, surface of the tongue, what nerve would be sensory for pain, touch, and temperature? So you bite your tongue, or like my daughter did when she was about 6, my son's birthday. It was a baseball game, and it was my turn to bring snacks, so I brought a bunch of little Jamba Juice, and she picked up she picked up a piece of dry ice, stuck it on her tongue. She still has a little bit of a scar tissue there. It's tiny, but. So pain, touch, and temperature?
Trigeminal.
Trigeminal. And that would be 5-3. The third branch. Trigeminal is also going to be motor, 2 muscles of mastication, chewing muscles. Your masseter. Temporalis, things that move the jaw. Now we have taste buds. So we have these large taste buds forming a upside down V, just between the lingual tonsil and the rest of the surface of the tongue. And these are oriented, they're flat with the surface, but they have a moat around them. So if we look at them in this view, they have that moat. And these are called the circumvallate. Papilla. And these have taste buds for the bitter taste. And they're down in the moat.
So they only sense bitter?
Yes. So what cranial nerve provides that? Bitter taste.
7.
No, it is a taste nerve, but not bitter. It's sweet, salty, and sour.
Well, not 7 in there.
Not 7. I can't write not 7 up here though.
9.
Yes. Cranial nerve 9 does circumvallate sensory. So bitter taste.
This one is 9.
So sweet,
Glossopharyngeal.
sweet, sour, what was, 7, which one did they have? Sweet,
Um,
sour.
Sweet, sour, and salty.
Thank you.
Uh-huh. And then glossopharyngeal. Is bitter taste. While I have it up here, I'm going to write also, it is parasympathetic motor to the parotid gland, our salivary gland. Just don't have to come back and put room for it. The next type of taste buds are shaped more like a toadstool. So they are known as fungiform, fungus, mushroom-like, and they are primarily concentrated along the margin of the tongue. There are some scattered here in the center, but more concentrated along the margin. And so these are the fungiform. And these are sensitive to the sweet, sour, and salty.
Are they concentrated on the side up to the very front of the tongue?
The anterior 2/3, so kind of along this margin here. Sweets at the front, sour, salty along the sides, but there's still some in the center, just not as highly concentrated. So this is cranial nerve 7.
Where does the fifth taste?
That's kind of like on the sides, so not just the tongue, but the umami, the meaty
Yeah.
taste, is kind of the back of the throat and the sides of the mouth.
It's
As well.
different than sensors than those.
Yeah. So cranial nerve 7, same as we had up here. Facial
Yeah.
is going to do sweet, sour, salty, and it's also parasympathetic to the other two salivary glands that we'll talk about in just a couple minutes, submandibular and sublingual. In addition to the fungiform and circumvallate, we have more plentiful than either of these two are filiform. And filiform, those are the ones you can feel when a cat licks you. All right, we don't really groom, but
That's what they're doing.
those are a little sharper. So they're shaped kind of like this. And they do not have taste buds.